change in how the CDC tracks the COVID-19 pandemic now is drawing questions from top doctors here in Atlanta.
The executive director of the COVID-19 task force at Piedmont Hospital says it's as if the CDC is moving the goalposts. Joe Hankey explains what's changed and why it may be harder to understand where things stand now compared to the past. Joe?
Well, Sheba, previously, one common way for tracking the risk of COVID-19 in your area was the CDC's community transmission ratings of low, moderate, substantial, or high. That would show much of Georgia currently has a moderate to even high risk in just a few counties. Now the CDC wants the public to focus on what are called community levels, and that lists the risk across much of the country and Georgia as low. Recent changes to how the CDC calculates the risk of COVID-19 transformed the country from concerning yellow and red indicating moderate to high risk to a calmer green indicating low risk. The CDC making the changes as it now focuses on hospital strain instead of new COVID cases.
We have more and more people and more immunity in the population. We wanted to make sure that we were focusing on severe disease because we do want to prevent severe disease. We want to prevent hospitalizations.
CDC Director Dr. Rochelle Walensky in late February discussed how the CDC would be focusing on so-called community levels instead of community transmission. It found community levels were better predictors of deaths in ICU patients than transmission levels. Community transmission is considered high if there are more than 100 new cases per 100,000 people, or test positivity rates are over 10%.
What the CDC has done is lumped all four categories together, low, medium, substantial, and high, and created this new category of low, which is actually higher than our highest caseload in the previous definition.
Dr. Jayne Morgan is the executive director of the COVID task force at Piedmont Hospital. She said under community levels, risk is considered high if there are 200 new cases per 100,000 people, double the old metric. And there are more than 10 new COVID hospitalizations per 100,000 people in a 7-day period, or 10+% of hospital beds are filled with COVID patients. She says the CDC is moving the goalposts, and Sunday tweeted the only reason that 98% of the country is now in low or medium risk COVID zone is because the CDC changed the definition of low.
It influences decisions that we're going to make about our health and about the health around us. Interestingly, the CDC still has both maps up on their websites.
And the specific hospitalization and bed usage data the CDC is now focusing on is data the state of Georgia has never released publicly. And here at 11 Alive, we have been tracking data on the pandemic for the past 2 years. So while the CDC now lists the risk around much of Georgia as low, we are unable to see if the state of the pandemic today is better or worse than at certain times in the past. Sheba.